Now, Australians have been given a rare chance to invest in a cannabis-based pharmaceutical facility in Queensland through the launch of Medibis. The company is set to start distribution of its product with plans to build a production facility in the future up in North Queensland. To tell us more about that opportunity is the founders Angus and Andrew Calvert. Gents, welcome to the Startup Daily Show.
G'day Simon, how are you?
I'm great. Sounds like you're busy at the moment. Tell us a little bit more about your plans.
Yeah, we're definitely busy. So our plans are centered around transforming quality of life, and we're doing that by making sure that Australian patients have good access to medicinal cannabis and that GPs have the confidence to prescribe. So not only the confidence to prescribe, but access to a range of efficacious formulations as well.
So you've got some plans to build a plant up in Toowoomba in Queensland. What was the appeal of that spot, and tell us about what it will mean for the business?
Yeah, so Toowoomba was a really logical choice for us for a number of reasons. Climatically, it's one of the best places in the country to grow that particular crop in a protected cropping environment. It means we're able to do so consistently and with the minimal amount of energy density, and therefore have a consistently high quality product at a competitive price point. But there's also Toowoomba is a great place because there's a rich agricultural and horticultural heritage. And when we're building something the scale of which we're intending, we need a lot of people with a broad range of skills, both in agriculture and horticultural and more broadly, and also to have good access to local universities and research organisations with whom we'll partner around the research and that particular aspect of what we're doing. So yeah, there's a whole range of reasons why we're here, and they're all very positive.
The Darling Downs is a pretty magic spot, and you're still less than 90 minutes away from Brisbane. So tell us about the ambitions in terms of the rollout of the plant and where you hope to be a couple of years down the track.
So the first stage is bringing the products to market, and that allows us to develop the pathways. So like I said, building on the relationships with the prescribers, building the trust there, giving them the tools to be able to prescribe. And what this first stage does is it allows us to look after our patients now. There's a bit of an issue with patient access with medicinal cannabis. So we want to bring these products to market from Israel. Israel's the center of medicinal cannabis research. They've been researching cannabis for 15, 20 years medicinally, but certainly probably since the 60s actually. So building those early pathways, building an early revenue stream, that will allow us to move right up to being ready to build our facility. Hopefully the plan is the start of next year, but there's certainly a few more steps that we need to go. We've got the land put aside. So eventually we'll bring all of that in-house. We'll be growing cannabis, producing, manufacturing and researching all in our Toowoomba facility. But building those things step by step and making sure that we're doing everything right takes a little bit of time. So yeah, within 3 years, we're looking to be scaled up. I don't know, probably around stage 2, which is about 10 tonnes per annum. Certainly we've got access there to the export market as well. So we can justify the scale, economies of scale within the facility by not only providing the medicine for Australian patients, but also exporting into Europe.
Now, speaking of steps, Angus and Andrew, you've got a virtual campaign underway. I think there's a little under 3 weeks to go on the expressions of interest. Take us through the numbers on that and your ambitions.
So the virtual campaign expressions of interest are open for another 18 days. All of that information is available either on our website, the Medibis website, or on the virtual website if you search for Medibis. We're looking to raise between $1 and $3 million, and we'll determine all of those numbers at the end of the EOI. But it's looking really positive. We've got a lot of great interest from the start. We came out of the gate really well, which obviously it's a little bit of an unsure time. You're not really sure how these things are going to go, but it's absolutely going really well, and we're on track to raise $3 million, and that'll allow us to initiate the the products to the market. So to build that whole system up, bring the products in from Israel, have them in storage and distribution here in Australia with an Australia-wide distribution network, and being able to access pharmacies and GPs.
It sounds like a great, ambitious project. We've seen plenty of Canadians coming out here on the medicinal cannabis front, so it's nice to get a little bit of Aussie oi, oi, oi into the whole thing. Gents, thank you so much.
Thank you, Simon. We appreciate that.
Angus,
Awesome.
Andrew, great to have you on. We wish you all the best with the virtual campaign for Medibis.
Thank you.
Thank you.